I'm here with Carrie Maniccia, 2018 graduate of Binghamton softball. How are you doing?
I'm good. How are you?
I'm pretty good, doing well. Um, Talk about, so you're working in Rochester right now? Where are you working?
I work at Unity Hospital, which is a hospital like right outside of Rochester.
And how many days a week are you there?
So I work full time in the emergency department. So depending on how my shift work is set up, it can be like 4 to 6 days per week.
What kind of hours are you?
So right now I'm trying to work two 12-hour shifts and two 8-hour shifts. But it's been a little different based on the census of the hospital. So this week I'm working like 4 8s and a 12, I think. But it really depends on the week.
So your duties usually, like what would you usually do in your job?
So there's a couple different like roles when you're in emergency. You can either be in triage where you're like the first set of eyes on the patient. You grab initial vitals, kind of listen to their story along with the triage nurse, and then depending on what they're in for, get an EKG, bring them right back to like imaging or just bring them back to a room, let the new nurse know like kind of what's going on. Or if you're in the back of the emergency department, you're assigned a section and you're responsible for that group of patients and like anything the doctors and nurses need.
That's a lot.
Yeah.
How has any of that changed a little bit since COVID-19? Have you had to switch to some other things? Do you have to like not do that completely because they just need hands everywhere?
A little bit. So the main thing that's changed is the amount of personal protective equipment we have to wear. Um, Once the triage nurse hears like the patient's complaints, if they like fall under the certain algorithm, they get granted enhanced contact precautions along with droplet or airborne precautions, which is confusing, but basically since the virus is spread via droplets, that basically means all staff members that enter this patient's room have to wear a face shield, a mask, gown, and gloves. So basically, we're trying to limit exposure. So we really have to kind of consolidate our tasks as much as we can into doing them all at one time. So one, we don't risk exposing ourselves over and over again by like coming in and out of the room, and so we can conserve personal protective equipment. So that's been the biggest adjustment, is kind of the change in the teamwork that we have to do with the nurses and the doctors and the PAs about communicating who's going to go in and do what at what time and how we can get everything done in the most efficient way possible.
How are you guys doing on masks? Do you guys have enough masks, or do you have to wear one like throughout the whole shift?
So it changes by the day, but as of right now, we are supposed to be wearing one mask per shift, um, just to conserve them. Right now, we have enough for sure. We also mask every patient that comes in. So literally everyone in the department is wearing a mask. And then there's different masks. So the surgical mask is the one we wear all shift, and then the N95 is the one that you wear if the patient is getting certain medications or if they have to be intubated, anything that's like aerosolizing the patient's droplets. Those you get and you keep. You can wear it like up to 5 times, and then you have to send it somewhere to be re-sterilized. But as of right now, we have enough masks, which I'm thankful for.
That's good. That's
Yeah,
not the case everywhere else.
I
Um,
know.
so what would be some of the biggest advice you'd kind of give that people may not be getting from the media, or like anything that you think that the media is portraying that just isn't correct? Like what's some advice that you could give, just being on the front line?
So definitely social distancing is a big thing. A lot of people, I think, have this virus and are just asymptomatic carriers. And the only way we can continue to flatten the curve is to stay home, only go out in public if you really need to. Like, I know a bunch of my coworkers and I, like, we've gone to the grocery store once every 2 weeks if we can. Obviously, we're exposing ourselves to the virus daily, so it's a little different for us, but I mean, just stay home, check on your friends, make sure everybody's doing okay. There are plenty of resources, like numbers you can call. You can call your primary physician if you're concerned, and they'll give you advice on what to do. But yeah, as much as I can say is just stay home. I know with the weather getting nice out, it's going to be hard, but the longer we put this off, the longer this like lockdown is going to be.
Regarding, so you said like call your doctor. Is that what, when there are people coming to the hospital, do they have to call beforehand before they show up if they're having symptoms, or are they allowed to come through the emergency?
So we actually have, and all the hospitals in our area have a COVID tent testing site, like outside of the actual hospital, where you are supposed to call your doctor first, but you drive up in your car. If you're specifically there because you are concerned that you have COVID, you can drive up and you talk to like medical professionals, nurses, and PAs that are outside, and they'll like assess you. And if you are stable enough to go home, they may swab you and just send you home. Everyone is supposed to call their doctor before they come to the hospital, just because if you don't need to be there, we don't want you risking exposing yourself. Some people don't have primary doctors, so it's not necessarily like a strict requirement that you call one, because if you don't have one, what are you going to do? You know? So it's not really anything that can be enforced, but most people are calling their primaries, or like if they're surgeons, if they recently had surgery, and getting advice before just coming in.
What do you know about the drive-up testing? Do you have to call before you go to drive-up testing too, or is that something
Mm-mm.
you can just go to?
Yeah, so you can go. It's not a guarantee that you will get tested. So um, the way it works is you don't ever actually get out of your car, which helps the staff limit exposure. But you start by like answering questions about like have you had fever, cough, shortness of breath? Have you been out of the country recently? Have you had any known exposure? Sorry, my roommate's dog is here now. And then a tech will check your vitals. If you have a fever, oftentimes you will get swabbed, but if your vitals are normal, but you still have some other risk factors, um, then you like go to the third tent. It's like 3 different ones. And then you talk to some more people. And if a lot of times, like if you're a healthcare worker, or if you've had like a lot of positive exposure, you can get tested, but it's really up to the people working's jurisdiction. And then you'll get tested, it'll get sent to the lab, and they'll send you home under quarantine for 2 weeks.
That's good information, actually.
Mm-hmm.
How are you guys on tests? Do you guys have a lot of tests, or are you limited so you can only test certain people if they come in with under the right algorithm?
So there is an algorithm. The people that are actually coming into the ED are generally more ill, since we do have the testing site as like kind of an initial triage. The test that we run is off of the flu swab. So like you get swabbed once and you can run the flu test. If that's negative, you can further run the COVID test off of that. So as of right now, we have plenty of tests as far as I know, but we are not just testing everyone. Like you really have to be, and you can see like when you see a patient, you can tell like, oh, this person is sick. Like we definitely should test them. But it really depends on the patient. There is an algorithm that the doctors and the PAs and hospital administration have worked together to kind of come up with.
Probably being on the front line, you have to be a little bit more careful because you're exposed to it every day.
Mm-hmm.
Have you been trying to stay in touch with your family during this time? I know it's hard. You probably
Yeah. No, the last time I saw them was mid-February, I think. And I don't know. Oh no, it was March. But I don't know when the next time I will see them will be. So FaceTime is helpful. Um, I talk to them often. They all check in on me pretty much every day. So it's not like I go an extended period of time without talking to them. So my sister is also interning at the New York State Department of Health right now, trying to help them out. And my dad is still considered an essential worker. So we're all kind of still involved in somewhat normal life. For us, it's just when we leave work that we just kind of go home and stay home. So it hasn't been that bad. FaceTime is helpful. Technology has been helpful. It kind of sucks that I don't know when the next time I'll see them in person is, but better to keep everybody safe.
What would be your biggest piece of advice for your parent, like people like your parents when they're still going out to get groceries?
I think a big thing, try not to touch all of the products unless you're sure you're going to buy it. That was kind of frustrating for me when I was there, is that some guy actually yelled at me for getting too close to him in line, and then went inside and touched like 6 different bunches of bananas before deciding on one. So I'd say definitely wash your produce when you get home. As far as changing your clothes, I don't think that's necessary. The virus needs something living to latch onto. So I would say it probably isn't going to last on your clothes, and somebody has to be like coughing onto your clothes for it to be dangerous for you. It doesn't really get spread just by breathing. It has to be some sort of like droplet. So I mean, wash your produce, wash your hands as soon as you get home before you unpack your groceries. Try to keep clean habits if you can. It's never a bad thing to be like wiping down your counters or any kind of cooking space that you're using, but I wouldn't say you need to strip in the garage or anything at this point.
I think I covered anything. Is there anything else that you think you want to talk about just before we kind of get off?
Um, I don't know. I think for current students, if you're interested in going into the medical field, it's a scary but exciting time to pay attention, and also anybody interested in like public health. Um, a pandemic is not something that we generally expect to see in our lifetime, but I think we can learn a lot from this experience. One, just hygiene in general. You should be washing your hands regularly anyway, but especially now, I think kind of looking at how hospitals and healthcare workers are reacting to this is important, rather than just going off what the media might be saying, um, and just kind of being careful. But if you're interested in going into the medical field, definitely use this as a learning opportunity and kind of help it push you forward. Oh, and also antibiotics cannot cure a virus. I just want to make that clear.
Very clear. Got it.
Yeah.